Hello, I'm Teresa. Welcome to another episode of Teresa's TCM Clinical Reflections. Today, I'd like to share one of the questions I hear almost every week in the clinic. Patients often tell me, I've tried physiotherapy, massage, acupuncture, medication, even an injection, but my shoulder is still painful. Whenever I hear this, I don't immediately think about another treatment. Instead, I pause and ask a different question. Why hasn't this shoulder recovered? That simple question has changed the way I approach persistent shoulder pain. Many persistent shoulder problems are not simply the result of ineffective treatment. In fact, many patients have already received reasonable care. What is often missing is a clear understanding of what is preventing recovery. Sometimes the diagnosis is incomplete. Sometimes an important structure has been overlooked. Sometimes the shoulder is only where the pain is felt, not where the problem begins. Before choosing any treatment, I first try to understand why healing has not taken place. When someone tells me the pain feels deep inside the shoulder, I begin thinking beyond the common diagnosis. One structure I pay particular attention to is the subscapularis muscle. Because it lies deep beneath the front of the shoulder, problems here are often difficult for patients to describe. Rather than repeatedly treating the painful area, I carefully assess movement and examine the deeper tissues around the axillary region. Sometimes what we need is not simply another acupuncture point, but to identify and release the structure that is limiting normal shoulder movement. Ultrasound and MRI provide valuable information, but they do not always explain why a patient is in pain today. Some people have significant rotator cuff tears but can still lift their arm surprisingly well. Others have severe pain, despite only minor imaging findings. That is why I never look at a scan in isolation. I compare it with the patient's history, movement, muscle strength, painful positions, and physical examination. The important question is not simply, what did the scan find? It is, does this finding truly explain why this shoulder has not recovered? Another lesson clinical practice has taught me is that the shoulder is not always where the problem begins. Sometimes the source lies in the neck, the scalene muscles, or even the brachial plexus. Patients often ask me, "My shoulder hurts. Why are you examining my neck?" I usually smile and explain that the shoulder may simply be where the pain is felt. The real problem can sometimes begin much further upstream. Unless that source is recognized, treating the shoulder alone may never produce lasting improvement. Not every persistent shoulder problem is caused by a wrong diagnosis. Sometimes the diagnosis is correct and the treatment is helping. But builders, athletes, painters, and people who repeatedly work overhead often overload the shoulder again before healing is complete. The shoulder starts to recover. Then the same movement irritates it once more. Instead of asking patients to stop living their lives, I try to help them reduce unnecessary strain so the shoulder finally has the opportunity to heal. Traditional Chinese medicine encourages me to ask a different question. Not only what structure has been injured, but also why has this body struggled to recover? Some patients present with cold, damp obstruction. Others have qi stagnation and blood stasis following an old injury. Some simply have a reduced ability to heal because of long-term stress, fatigue, or poor recovery. These patterns do not replace modern diagnosis. They help explain why two patients with similar shoulder problems may recover very differently. Once I understand why the shoulder has not recovered, the treatment becomes much clearer. If a deep restriction is limiting movement, I focus on releasing that structure. If the problem begins in the neck, my treatment follows that direction. When appropriate, I may combine acupuncture with moxibustion, cupping, or bloodletting to support recovery. The treatment is never chosen simply because the patient has shoulder pain. It is chosen because it matches the reason recovery has been delayed. Clinical practice has taught me that responsible care does not always begin with acupuncture. If I suspect a significant tendon tear, progressive weakness, neurological involvement, or another condition that does not fit an ordinary shoulder disorder, I believe further investigation is more important than immediate treatment. Sometimes that means recommending an ultrasound or an MRI. Sometimes it means asking the patient to return to their GP or see an orthopedic specialist. Knowing when to treat is important. Knowing when not to treat is equally important. Looking back over the years, I realize that my thinking has gradually changed. When I first started practicing, I focused on treatment techniques. Today, I begin with a different question. Why hasn't this shoulder recovered? Modern medicine helps me understand structure. Traditional Chinese medicine helps me understand function. Together, they remind me to look beyond the painful shoulder and understand the whole person. Thank you very much for watching today's reflection. I hope this clinical story has helped you see persistent shoulder pain from a different perspective. I'm Teresa, and I look forward to seeing you in the next episode of Teresa's TCM Clinical Reflections. Take care and goodbye.